and welcome to Star Wrap, the Art of Tissue Transformation. My name is Tate Yoder, and I'm going to be your guide on this journey of unlocking the secrets of your fascia. So this is going to be an exploration guiding you through the ankle, knee, wrist, elbow, knees, hips, lower back, spine, and upper shoulders. And the idea is to unlock your fascia. So what is fascia? Fascia it's a connective tissue that wraps around every muscle spindle, muscle fiber, muscle group, every organ. Everything in your system is wrapped by fascia. And what it is it's called the neuromyofascial web. So there's 10 times more nerve endings in fascia than in your muscles. So that means the communication from your nervous system to your muscular system is responsive, and you're more in tune to that communication when you're tuned into your fascia. So when you look at athletes, you look at performance, you look at just movement, grace, and ballet and dance, it's an awareness of your body, and that awareness comes from tuning into how does your foot and ankle communicate to your knee, communicate to your hip, up your spine. It's also called the kinetic chain and strength and conditioning circles. So we're really going to begin exploring how to move your bones, and we're going to show you each of the bones related to the area we're working. How do you get the bones to interact in a new way and in a new dialogue and have a new conversation with each other? Because if you can begin to have those bones articulate and move in new ways, the muscles that attach to those bones are going to be challenged out of their repetitive movement. So first we have to tune into where your repetitive movements are and what that pattern looks like throughout your whole system. And then we get to unwind it. And that starts with high repetition movements, because high repetition creates more blood flow. And so we're breaking the pattern through high repetition movements where we're moving in a new way and without pain. That's a very crucial point. So we don't want to take you into any pain at all through this movement system. So I want to get started right away. These are expert strategies. I've been working with the body for 25 years. I understand how fascia works. I'm trained as a structural integration therapist, which is like a rolfer. I've been in strength and conditioning my whole life. So this is working with professional athletes. This is helping people out of pain. So applying this methodology is going to really help you tune into what's going on in your body and give you some very powerful strategies to unwind them and to relax them. So I'm so happy you've joined me here on this journey. I'm ready to get started. We're going to do a little bit of a breakdown of the content. So we're going to get into 3 concepts. The first step is unlocking the secrets of fascia, which I just covered that step with the movement of the bones. So the 3 concepts are intensity, duration, and frequency. So we're going to explore what that looks like, because each of you are different. You're going to have different levels of mobility. Your tissue is going to respond differently to what we're doing. And this is going to lead us into the strategies of the physio ball and the star stack method, where we're actually going to target those areas that we're identifying now and teach you how to release them through direct pressure and use of the star stack. So here's the star stacks. We've got the specific and the linear star stacks, so we're going to get into those in the next video. But then we're going to get into ankles, knees, hips, low back, spine, shoulders. So here we go. When you're wanting something different and something that you've never had, you need to do something you've never done. So we're going to be moving in new ways, in different ways. We're going to explore what each of the joints' movement possibility is with flexion, extension, inversion, eversion, rotation. Every joint has a specific movement that it can do, and what we're going to do is explore combinations of those movements to really isolate those fibers and restrictions in your body. So that's the step 1, unlocking the secrets of the fascia, high repetition movements without pain. So the intensity, as we get into intensity, I want you to just think about when you get into a stretch, if you go too quickly, it's going to be painful. Okay, so stretching becomes something you don't want to do. because it hurts. So this is an enjoyable process. We're just wanting to get you to tune in at the most gentle level of what your range is, and then through the high repetition, that tissue begins to open up, and the body says, okay, go deeper. You don't tell the body to go deeper. So that's a very big distinction, is what is your body allowing you to do, and how to work with your body to get it to adapt to what you're asking of it, because it'll adapt to whatever you want. It's called the SAID principle, specific adaptation to impose demand. So we're going to ask something different, and the body will adapt. So the duration is how much time you're spending in any of these positions, because it's really a therapeutic process here. So we don't want to rush it. This is your time. We want you to honor it. We want to honor how the body works. You have to be patient with the body. You can't force it. So it might take longer. So I invite you to spend some more time unwinding. When you find areas that are problematic, just pause the video and really get into exploring at whatever level, whatever depth is appropriate, which is some of the concepts we're going to be explaining and getting into. But spend some time listening to your body, and I will be guiding you, but this is to try to understand your body, and I'm communicating to you through this media, so I can't see you. That's the one-on-one sessions that I can do, where we can really explore what's going on with your body. But right now, I'm guiding you. The frequency is just making this a habit. So instead of standing still, which is what we do, or sitting still, the physio ball is something that I use just to illustrate the point of oscillating movements, because our bodies are 60-70% water, so they're fluid. So we want to be fluid with our movements. I'm not standing still now. It's little oscillations, which gets your body to adapt to that stimulus. So instead of being still and stagnant, what happens with stagnant water? It gets toxic. So we want to be fluid. That fluidity helps flush toxins, helps the muscle fibers floss and gloss, and helps the fascia go from a viscous or a gel-like state to a more viscous state. That's called thixotrophy. So we're getting that fascia to actually melt and become more fluid, which is where we get the responsiveness of your entire system. Okay, so here we go. It's time to close off the rest of your world. The rest of the world, close down your laptop, unless you're watching this on your laptop. Close down your any other distractions. Try to find a nice peaceful space, and this is your time to tune into your body. So let's try to honor it with the peace and quiet, and begin with 3 deep breaths. So the idea with it's called box breathing. So we're going to take an inhalation, and it can be a 3-second, 4-second, 7-second, whatever your breathing rate is. You're going to inhale, then you're going to hold it for that same amount of time, and then you're going to exhale that same 7, 3, 4, 5 seconds, and then you're going to expel and squeeze for that 7 seconds, get all that oxygen out of your system. We're going to do that 3 times, so it's called box breathing. So here we go. Inhale through your nose, exhale through your mouth. Inhale. Exhale. And squeeze. Okay, and really focus on filling up your lungs, getting your ribs to expand, getting the oxygen to your chest. Okay, so start with your belly. Inhale. Hold. Exhale. And expel. Okay, nice deep breath. This is helping tune into your nervous system, so it's really beginning to calm you down and get you focused on your breath. So last one, inhale. Hold. Exhale. And expel. Okay, into unlocking your hips. So the hips, we sit around, we stand still, a lot of tension in our hips. So we're gonna be really working on the squat pattern and how to break out of the repetitive movements of the squat and getting into really how to floss that lumbar spine as it relates to the sacrum. So the bones of the hip, you've got the femur connecting into the acetabellum, you've got the ilium, the ischium, you got the sacrum and the sacroiliac joint. So the sacrum and the ilium it's called the SI joint. That's an area that's going to have sometimes a lot of tension. If there's too much muscular tension around those hips, that SI joint begins to get into problems with each other, with the relationship. So we're going to be focusing on flossing and getting these bones to begin moving and gently articulating with them in a new way. So start slow, start gently. If you have any lower back pain, I want you to move very slowly and carefully. If you're experiencing any pain, I want you to back off. So don't go into the pain. Go to where you can handle it without pain. So if there's pain, back off and minimize the movement and see if high repetition microflossing movements, which is we're really getting those muscles to begin articulating, can help lessen the pain. But if the pain starts going up, stop the movement entirely, because if we're dealing with lumbar pain, the discs, bulging discs, slip discs, herniated discs, any kind of things going on in the spine could be very problematic. The nerve supply isn't coming through, so we want to be very careful. So moving into the hip joint with the squat pattern, I'm sure you're familiar with the squat. So the idea with the squat, engage your core, hips go back. If you can, tip your hips forward and then begin the squat. So you're engaging your core, keeping that core tight and relaxing the glutes. The glutes are doing the work. So tip the hips forward, small little movement, trying to get a good angle of the movement. Chest stays up and you're microflossing it. So nice small movement. If the knees are going forward, we're quad dominant. That means your hips are not firing. So we have to get the hips to fire. So the first movement is hips going back. So even if it's this far, it's fine. We're going to start working on improving the range as we go. Okay, so a little more movement, a little more movement. And what we want to do is start thinking about how our feet are planted and how they relate to each other. So most people, if we're doing a squat, maybe you've got the bar, maybe you've got the dumbbells, front loaded, however you're doing your squat, if you're doing squats, we're in that same mechanic over and over and over. So what I'm going to start exploring is how can I move my feet around in different positions to get a different angle in my squat. So the femur is going to line up differently. My quad muscles are lining up differently. My lower back is being challenged in a different way. So how many different ways can we explore shifting in a squat position and recruiting different muscles to perform this basic pattern, this basic movement pattern. Okay, so play around, small little micro movements, flossing, and then as you begin to warm up, you can start doing more shifting laterally. So once we've kind of got our, so this was the lateral lunge, right? So now we're just going to shift laterally in that squat position. So squat, hips go back, and shift laterally. Okay, shifting laterally. And you can really get into exploring this as we get into, think of a skier, they're going left and right on their skis, they're going under the knife edge. So exploring those same concept of the 3 points of contact. Okay, how can we do a squat? Can we do a squat while we're balancing on our heels? Okay, can we do a squat while we're balancing on our lateral knife edge? Can we do a squat on our toes? Can we do a squat, heel on one side, lateral edge on the other. Switch it up. Okay, can we go to the toe and heel? These are all different mechanics that require us to balance, always keeping the ankle and the knee at a 90 degree. Okay, so don't come out of that position. Don't have the knees come forward. Hips are engaged, and explore the different patterns of squat. Okay, then we're going to get into getting into the adductor group, which is your inner thigh, so we can move our feet a little bit further apart. And we're going to continue squatting and shifting, but now we're going to think about how our lumbar spine, our lower back, is connecting into our sacrum. Okay, so before we've been keeping pretty much an erect spine as we're doing the warm-up. So now we're going to start shifting the spine, the lumbar spine, as we squat. We can squat and bend to the left, squat and bend to the right, squat and bend forward. And just so you have a good pattern here, squat and bend to the right, always keeping that 90-degree angle. Okay, and then we can really start exploring little half moon crescents. Squat and bend. How is your lumbar and your sacrum talking to each other? Okay, so shifting, you can really start getting rotation going within the hip. So we bend forward, we go into a little gentle extension. If you have any lumbar problems, any lumbar spine problems, this could be painful. So come to neutral. I wouldn't extend too far back if there's any pain. So you're exploring squat, lateral bend, extend, and getting nice little circles. And then again, what can we be doing with our feet to work on balance? Okay, so we're putting ourselves into a squat mechanic, we're doing a bend mechanic, and then we're balancing on different parts of the feet. Okay, so just explore how we can use balance and proprioception, which is going to engage the fascial system in the squat mechanic and in the incorporating the lumbar spine and upper torso movement within the mechanic. Okay, so it's an exploration here. So begin tuning in to what's going on in your lumbar spine, in your hips. What do you notice? Where is the tension? For me, on this lateral side, the muscles of the QL and the erectors, I can notice some tension. So I'm just going to go exploring that. It's a very normal area for people to have. They have low back pain. Their QL, quadratus lumborum, attaches from the ilium to the ribs, the 12th rib, can be very tight. So we're going to isolate through getting my ribs and my ilium to explore, all right, where is that tension in that QL? What movement do I have to put myself in to isolate that specific area, that specific targeted musculature? So for me, a lateral bend, a lateral bend is going to get that QL. So we're going to do a lateral bend in that squat mechanic. Okay, maybe do a little balancing on a foot. So I'm having to really engage my entire system. And then I'm going to microfloss the ribs and the ilium. So we're getting those two bones talking to each other and articulating with high repetition movement without pain to get a lot of blood flow into the area I need it. Okay, so we're here, rotating. I'm just basically getting my ribs and hips. Let's see a better position. Get a better position on this. And I know it looks awkward. It's okay. Hopefully nobody's watching you. And you're going to be moving in a little different way because we're trying to isolate the pattern and break it and that requires you to explore what the relationship looks like between those two bones. Okay, so you can get your arm in, getting my whole lat involved as well, getting rotation, okay, and then explore the other side, you know, try to balance it out. So we don't necessarily just want to, don't be too aggressive with one side, so we can explore what the other side feels like. And really we're just working on that lateral line, the ribs and the hips. This is leading us to the next step, which is going to be the entire spine. So we've done little rotations. If you find anything, say you're finding something in your hips. A lot of my clients have pain right in the middle of their sacrum. Okay, so what we're going to do is, so there's a deadlift is a very common pattern. Let's see, so that's getting, all right, where the deadlift is next. So right now we're just going to be focusing on how that sacrum, so if we get into a deadlift, we're engaging through small little movement the muscle attachments on the top of the sacrum. So in this position, engaging your core, you're shifting down. You can start rotating your upper torso in a deadlift position. So proper deadlift, engage your core. Legs might be slightly bent. Romanian deadlift or straight leg deadlift. That's the normal posture for deadlift. But what we're going to do is just begin that movement and then begin rotating. So we're not putting a lot of stress into the pattern of the deadlift. Okay, we're just doing a small little activation with rotation, and that's going to get all those muscles of the back that attach onto the sacrum to be challenged in a real gentle way. So we're not looking to stress, we're not doing hardcore exercise here. This is all warm-up and recovery-based thinking. So this is this kind of stuff you do in off days of training. Say you just did a deadlift back day and you're sore, this is what you're going to be doing on your days off. This is all recovery training designed to help you recover and get the tension out of your body so you can perform better when you're doing your sport or just in life. Okay, so that's kind of opening up the obliques, the lumbar. So we're going to get now into the lower back. We're going to do a few more patterns of the squat. So we did the shifting on the knife edge of foot. We rotated the upper torso in a circle. The shin touchdown, 90-90. Okay, so the shin touchdowns is we're getting into a squat position. So depending on how comfortable you are in that squat position, this is how a lot of people around the world hang out. If you see them in markets, people who are able to sit in this position for hours, they've adapted. Okay, so what we're doing in this position, so depending on where you're at, so I'm trying to coach, if you're here, you know, and you can't quite get to that low squat position, what we're gonna do is bring that shin down to the ground. Okay, so we're just bringing the shin towards the mat. Okay, so the idea is we're turning our leg in, bending, and bringing that knee as close to the ground as you can. Okay, focusing on my ankle, look at my ankle and foot. There's bend there. So depending on what your mobility looks like in your foot and your ankle, you know, if it's restricted, you're gonna be moving kind of like this. Okay, so it's gonna kind of be that type of movement. As you warm up, as the body opens up, you're able to get a little deeper, and then you're able to get a little lower. Okay, so you're kind of moving into this position, and this is going to be very taxing for you because it takes a lot of mobility. I do this with high school soccer players; they can't do it. So it's not an age thing. It's how you're challenging your body, what you're asking of your body to adapt to, and what the state of your tissue is in your joints, just based on life and based on the way we train. So ideally we get to this position and then we're bringing our shin down to our knee. Okay, so it's just bringing those shins down. You're gonna feel it in the hip flexor, depending on your sacrum, your health of your hip. This is gonna be easy for you, or it's gonna be quite challenging. So this is shin touchdowns. And then the next one we're gonna do is called the 90-90 hip drives. So we're gonna put our bottom leg at a 90 and our top leg at a 90. Okay, so both legs are 90 degrees, okay? 90 degrees. What we're gonna do is draw, kind of settle down, bringing that back hip down towards the mat. And you can really like draw it down into the mat so you can engage your hip flexor, your adductor in that back leg. Just draw it down to the ground so you're really kind of focusing on settling into this position. And then what we're gonna do is to do that for 5 to 10 seconds. Draw it down, engage that adductor group. And then we're gonna roll forward onto this front shin, okay? And we're gonna use that back leg we're gonna roll onto that knee, and we're gonna drive our hips forward. So if you have any trouble with this, you can use your hands to support yourself, to lift yourself up, and then drive the hips forward. And then here's the challenge. I want you to return to that position as slow as possible. Okay, so you really want to control the deceleration or the lowering back down to the ground. So what is going to happen, if this is the first time you've done this, you're going to have trouble rolling up. So you're going to have to support yourself, but you're going to roll up. You're going to drive your hips forward, both hips forward as much as possible. You're going to start rotating, and then where those muscles are really restricted and not able to fire, you're going to drop. Okay, and that's just waking up the muscles that are controlling this movement and getting them to fire. And this will happen if you just keep practicing. So your nice, slow return, slow and controlled. Okay, and as soon as you find an area where you're like, you fall, you can support yourself and then floss that area. So you're supporting my weight, and I'm just flossing that specific area where you drop with small little movements. So you're up and down, small little movements, flossing that portion of your piriformis, your glute max, your whichever muscles in your hip joint are restricted, we're gonna floss them. So 25 times, up and down, micro flossing that hip, nice and slow. That should bring some more blood flow into the area. And then try it again. You go up, see if you're more smooth. Okay, so you can do that both sides, 90-90 on both sides. Work on drawing your hip down, rotating for 10 seconds, draw that hip down. Using your breath, inhale and exhale. Remember to be breathing as we're doing this. Inhale, exhale. Roll forward onto that front leg, drive the hips forward, and then nice, slow, controlled return. Okay, so do it about 3 times. Work on controlling it, and when you find an area where you're tight, support it and microfloss it. Okay, that's 90-90 hip drives. Dynamic leg cradles. So you've probably seen a leg cradle like a little baby. So depending on where you're at with your flexibility, you're gonna grab your ankle, your knee and your ankle. You're just gonna support this movement of the hip, okay? And you're just trying to rock it and cradle it like a little baby. Just swing it and rock it. If you can grab it tight. And you're just moving and rocking that hip. Wherever you feel restriction, slow down and microfloss. Okay, so if you feel any kind of tension anywhere in that joint, slow it down. However you're holding it, microfloss the area. Get that femur turning inside and out, internally and externally inside the hip joint. Just wake it up, but you're not having to engage your adductor, your glute muscles, because you're doing the work. So because I'm holding my leg up, I can relax my hip and just let my bone move in that joint without any tension. Okay, so that's the idea, is how can I get my hip to open up without putting too much stress as I activate it. And then the dynamic rotations of the hip. You've seen this. There's a lot we can do with our hip joint. So you can go up, kind of like that, like a dog or cat, taking a wee. So the idea is push up, externally rotate, bring it around, and back down. So out, up, externally rotate, bring it around. Okay, and you can do that opposite way as well. And just explore what that feels like. And again, really, the art is finding any movement that's restricted and isolating it and activating it through high repetition movement. So any position of this feels tense, microfloss that area, and that's giving you another range of motion for the hip rotations. Both legs, explore what that feels like, noticing anything in that hip joint, and begin to open it up. So that's going to conclude the hip section. Next, we're going to be moving into the lumbar spine and really starting to work on what's going on in the lumbar spine. So we'll see you there.